Okay. So, good evening, everyone. My name is Oekeke Igado Kure, and I'm a media practitioner. I'm also a fashion entrepreneur, and I'm a registered nurse midwife for over decades of experience. I'm very excited to be speaking with you on the forthcoming healthcare training. This training, like Doris has been speaking about, is very crucial for healthcare professionals and those of you who are seeking to get into the healthcare industry. And this training by Push Africa is designed specially to equip you with the relevant skills and capacity needed to enhance your chances as a healthcare professional and make you more attractive to potential employers, both home and abroad. And this is because you have competitive advantage as you are going to be updated with industry developments and best practices, which will, by the end of the day, set you far apart from others. And this is why this is a training that you should not miss because it will prepare you seriously for diverse patient needs, like Doris has spoken about, and emerging healthcare trends. And of course, like she said, you will receive license and certification after this training. And so I cannot tell you so much on all the benefits of this training, but they are huge. But what I can assure you is that this training meets international standards, and it also will increase your chances of employment greatly. Our curriculum will also be built around your professional growth, networking, specialization, and increased earning potentials, amongst other things. And so I thank you very much, and I look forward to seeing you hopefully at the training itself. Thank you.
Thank you so much, Mrs. Oikeke Igado. Thank you for that encouragement to our students.
Thank
So,
you.
like she had mentioned, she is very vast with diverse experience. She's a broadcaster, a veteran one at that, with many decades of experience. Interestingly, she's also a registered nurse. So, I mean, you can just imagine how somebody is a media person and is a nurse. I mean, it just means that she has so much, to share. So you're going to be having to meet her as one of the resource persons who will share with you as many opportunities, from diverse, in fact, from these two industries. So that, I mean, you can learn to be a nurse or a nursing assistant. You can also learn some of the communication skills that can help you find opportunities in the industry and be a bit more effective. Because, of course, being a nurse assistant also requires for you to communicate effectively as well. So imagine that you have two quality stuff packed in one person, and she's going to be, available to share all of this with you. So I'm going to let Dr. Adigun go on now to talk to us, and he's going to share his screen. So let me just give him the admin right so that he can go on to share his screen. Dr. Adigun, you can go ahead. I've been able to give you the admin right so you can share your screen and you can go ahead with the presentation. After Dr. Adigun, I'm going to let Nurse Joyce from the Philippines join us. So please go ahead, Doctor. You can go ahead and share your screen as well.
Good evening, everybody.
Good
This is
evening.
Dr. Adigun Kende, and I'm going to talk about as you can see, I'm a nurse, I'm a doctor, I'm a specialist, and as well as chemical pathologist. I just want to, look at the global health manpower, the role of healthcare assistant. My outline is going to be maybe a short introduction, definition of health and manpower needs, as well as locally, the historical briefs, basic skills needed for this course, and the course plenty rewards. Introduction: Health and its promotion and preservation determines the human development index of a nation. And health is actually wealth of a nation, an individual. When the population is in good health, then the overall economic index of the nation improves, for their productivity is enhanced. At the present moment, globally, the illness burden is increasing on a yearly basis. Yes, the healthcare workforce continues to be stagnant or declining, especially the highly specialized, like qualified nurses and doctors. Healthcare assistants work under these professionals to reduce their stress and improve patient satisfaction. Health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, as defined by World Health Organization. Manpower needs in healthcare, in health, preventive, therapeutic, and rehabilitative, as well as in community health services, are so diverse. These manpower needs are grouped along the professionals and the non-professionals. The professionals are doctors, nurses, physiotherapists, medical laboratory scientists, and so on. And the non-professionals are the medical assistants, the nursing assistants, and so on. The non-professionals work directly under the supervision of registered trained professionals, and these are the medical assistants as well as nursing assistants. The roles of healthcare assistants, some of these roles are actually been mentioned earlier, but most for basic daily needs of helping to feed, moving around the patient, as well as taking care of the grooming of the patient. They help in assisting in nursing in carrying out some nursing activities, especially the one that are provided by the registered nurse practitioners. And also they do some specimen like urine, and then cleaning up environment, and also give emotional support. The needs assessment. Globally, certified nurse assistants are needed more in the Europe, in the developed countries like Europe, the Americans, and the Canada. The need for them increases yearly at the rate of about 6% since 2021. And the advent of COVID has actually, shored up the need for them, and which is now getting more. Locally, the need becomes escalated with the latest so-called Japa syndrome, where professionals migrate as exodus to other greener lands. Historical briefs. Well, the nurse assistants, they have been around for some times, and actually, this one actually started with during the war times, when they normally take care of the war people that are involved with trauma and so many other wounds and all these things. And also, at the post-war, we found out that they are now needed in ensuring that most of the prescriptions of doctors and nurses are taken care of, as well as caring for the elderly, especially the aging population that is now increasing. Also, the era of technological era, the evolution of technology is changing their faces, and this is the reason why adequate training for certification is important for them. Also, in community services, taking care of the people in the community, as well as involving in some of the medical outreaches, as well as a medical therapies is important. And because of the dwindling professionals like nurses and doctors, they are always around to make sure that these particular services are not neglected. And then the with the advent of a medical, therapies that are now improving every day, we now have a lot of aging populations that, needed, to be taken care of. And most of them, they are in the nursing home, they are in the home for the aged, and so many other places. And the nurse assistants, they are all, ready for this particular, for these particular activities. Now, basic skills of a certified nursing assistant. Well, there is this particular, triad of the eye of an eagle, the heart of a lion, and the hand of a lady. That's always, important in nursing or caring for the, patient. So, therefore, the nurses, the nurse assistant must actually have a compassion to human life, a compassion to care, a compassion, to love, and also you should be able and ready and eager to learn. And with all these qualities, you will have a lot of progress in the profession. It should also be ready to contribute its own quota towards humanity development. Now, in conclusion, this is a course with plenty rewards. And when we talk about personal rewards, it is highly paying, and then there is a lot of self-actualization, and then with a lot of self-motivation, one can reach greater heights in the profession. And then professional growth and development are always enhanced, and you can actually use this nursing assistant as a point to project yourself into getting yourself into the profession, either full profession of nursing or medicine or pharmacy. Thank you very much.
Thank you so much,
Hello.
Dr. Tunde, for that brief overview. And thank you for even bringing in a bit of a history of the nurse assistant. For some people, there's a bit of misunderstanding. There's a bit of misunderstanding as to if learning or studying or training to become a nurse assistant or a medical assistant means that I'm a nurse. Please, they are not the same thing. For the records, the nurse assistant just provide support services to the nurses, like Dr. Adigun said. They help to administer drugs. They help to provide care and assistance to the patient or to the clients, depending on where you're working, whether it is in the hospital or is in a nursing home, or depending on, your call of duty, basically. And I have someone who is my teacher. In fact, one of the things I told Dr. Adigun and a few persons who were willing to listen is when I decided that I was going to offer, put together this program to get as many people to be a part of it, I decided first to go and learn the course. I decided first to enroll for the course. So I actually enrolled for the course, and the next person who's going to be speaking is one of my lecturers or one of my speakers. She's from the Philippines. I did this training in the UAE in Dubai to learn the rudiments or the skills or what a nurse assistant is supposed to be, what opportunities are available. Now, I did this training not necessarily because I needed it, but I needed to be sure what sort of value, what sort of opportunities, what sort of information and resources available there for the trainees to get it. So what it means invariably is that before I decide to let you eat the food, I tested it first. I needed to be sure that it was good enough for you to eat before I decided to. And everyone I tell about this experiences is commendable. It makes sense to want to do it, even though I didn't really need it. So I'm going to get Nurse Joyce to speak to us. She's joining us from Dubai, but she's going to share more light about the opportunities that are available, some of the information that you might need to have. So Joyce Nurse, my lecturer, the floor is open. You can go ahead and unmute your mic and speak. Thank you.
I don't think. All right. It's 11 o'clock here in Dubai. How are you doing, everyone?
We're fine. Thank you, Nurse Joy.
Yeah, okay. How many of you is with us right now? Like
I think
how many enrollees or how many
okay.
students to become right now?
I think at the moment we have about 11. We're looking to have 50 to start the class on the 30th or between 30th of September or October. But at the moment, I think we have about 11. So we're hoping to have 50. The class is supposed to be about 100 regularly. But for this first batch, we're willing to start with 50.
Okay, thank you so much for welcoming me. Okay. Uh, uh, I will going to go directly on what is going to do about CNA, Certified Nursing Assistant. All right. Okay. If you're going to do the Certified Nursing Assistant, it doesn't need you to become a nurse first before becoming a Certified Nursing Assistant because basically that is a different thing. Number one, you just need to be a high school graduate for you to become a certified nursing assistant. You don't need to reach a college level degree for you to become a certified nursing assistant. That is very group. That is actually a good news because
Mm-hmm.
certified nursing assistant
Mm-hmm.
is working through the supervision of a registered nurse,
Right.
whether you are in the hospital, whether you are in the rehabilitation center, whether you are in the dialysis center, heart center, anywhere. All right. So you are going to work primarily with the supervision of a registered nurse or the supervision of an LPN or licensed practical nurse. That's another
Mm-hmm.
thing. But I'm going to discuss to you, like brief, what is your main focus on the job itself. All right. So that at least you will not go further or for us to avoid any legal conflicts or any legal
Thank you. Thank you for
issues
mentioning that.
later on.
Yeah.
Okay. Because as for the nurses, as for the all the medical personnel in the hospital, we are under legal responsibilities. All right.
Sure. Sure.
So under the CNA or certified nursing assistant job key roles or responsibilities, you have to know 25 or more than 25 skills that you must have. So, primarily, we need to assist in bathing, in grooming, toileting, turning the patients, and so on. But for the medications, we are not allowed legally. Okay, we are not allowed to give medications because that is the job of a nurse. So we are the backbone of the nurses. But of course, I am telling you that do not misinterpret or do not degrade yourself when we call you the backbone of nurses because for us also we are the backbone of doctors. We are the backbone of hospitals.
Right.
So in the medical field, we are all backbones. We are all support groups. We
Mm-hmm.
support each other.
Mm-hmm.
And we work together as a team. We do not, in the medical field, we don't have any man is an island. No, because we collaborate each other. We brainstorm each now and every moment and every minute with the doctors and nurses to come up with the best treatment plan, with the best nursing care plan for the patients because the patients is there in the hospital, because the patient is there in the nursing facilities, in the elderly care, because they are in need of our helping hand. Okay, that is a different thing also when it comes to caregiver. Okay, caregiver, anyone can be a caregiver as long as you have the compassion on giving care from your heart, from your hands. But certified nursing assistant is covered with legalities. So you understand those kind of things. And also, firstly, I, I wanted to give a brief introduction from my side. I I became a travel nurse. I also became a head nurse from year 2014. And also, primarily, I'm working in the rehabilitation center here in Emirates Hospital in Dubai. So I've been doing nursing job for almost and more than 16 years now. So I want to add and I want to mention as well that we nurses like me, okay, primarily uh some other people they called us or they name us um the slaves of the hospitals. Yes, it's true. It's true actually, because it's like housemaid. It's not a housemaid, but it's a level up. It's a level up slaves, because we work for the patients, we work for the hospital, but that is really our job. They said also when I was studying in the university that we are called angels. So primarily, the job of a nurse and a certified nursing assistant, licensed practical nurse, and vocational nurses are the same on a matter that we are all working directly to the patient's care. And that is called bedside nursing, bedside care. Everything for the patients we do. So what do you expect in this course is that you're going to learn about um, inserting Foley catheter in the patient's male or female, turning. So even range of motion exercises, even diaper changing, even toileting, even toothbrush, feeding, anything about the patient. Because in the university, or even in our curriculum, or even in the lectures that we're going to to tackle later on, if I'm not saying I'm a perfect lecturer, I'm not saying I'm perfect fit for this one, but I must say that any instructor that is teaching certified nursing assistant or LVN or any related for nursing, I can say that that must be experience in handling direct patients from from her
Sure.
from him or from her.
Yeah.
Because if you are just from the university and you just finish and you are teaching, you cannot teach anything, because certified nursing assistant is all about experience. It's all about design. It's all about art.
Right.
One patient is different from the other. One patient treatment, one patient's nursing care plan is working to that patient, and to the others is not the same. So we have all the time on earth to make or reinvention, or to upgrade all the time
Mm.
uh the nursing care plan, or the design that we're going to give to our patients. But most primarily, those who wanted to pursue this nursing career, the CNA career, congratulations, first of all. And also, first uh, skill, I can say that it's a skill to have before deciding to take the CNA, is for you to have a compassion. You have to have a compassion,
Right.
and secondary only
Right.
your intelligence, because caring is smart.
Right.
Being smart on the job itself, like uh being smart on the job itself is not
Mm.
the primary
Mm. Yeah. Yeah.
focus on nursing care. The primary focus on nursing care
Yeah.
is all about the art on giving
Yeah.
nursing on nursing patients.
Right.
All right. So other students are welcome to ask
Right. Absolutely.
questions.
Absolutely. Thank you so much, Nurse Joyce. Yes, this is a point where the students are required to ask questions. Like I said, we're still enrolling what the training is all about, what they're going to expect to get. We've shared the curriculum with them.
All right. May I
They
add
kinda have an
one?
understanding.
May I add one
Go
more
ahead.
thing?
Go ahead.
Okay. Because you have taken the CNA course, I suggest that after you have taken this course, look for a job, and when you have a job, do not stick to the position
Yeah.
that
Right.
you have. I suggest that you upgrade all the time
Right.
yourself, because
Right.
there are a lot and millions of opportunities from CNA
Right.
to LPN, as I told you, a licensed practical nurse, licensed vocational nurse, to you, you might not know that one day you
Right.
will become a full registered nurse. And you know, in America, in Canada, in Europe, in the nursing field or in the medical area, nurses are all the time in demand.
Absolutely.
In demand job. So IT information technology is in demand, but also we're living on earth. Like if one baby is born, there are a lot of elderlies who's getting sick,
Right.
who needs care. So you
Right.
know, the numbers of people who needs to go into the hospital, who needs to go into rehabilitation, is
Increasing
rising.
every day.
Yes, in increasing every day. So as Miss Doris mentioned to you, you can go anywhere, even in the school. You see, teachers are there in the school. All right,
Right.
teachers are there in the school, but of course, teachers doesn't know, or the job responsibility of teachers are to look or teach for those children or for the students, but it's not their job responsibilities to look after their health. So
Right.
in the school, nurses are present in the municipality, even in any government, or even in private sectors, airplanes, um logistics. Oh, all right, one more thing. There are new job opportunities for cruise ship. Yes, cruise ship.
Yes. Yes.
Because uh, don't you know that there are a lot of elderly people who are purchasing room as their retirement home in the cruise line, in the cruise ship. So what they do, they take also caregiver or CNA with them while traveling all over the world. I have seen in a lot of portals that CNA job opportunities in cruise ship, cruise line, because nowadays everyone can travel. As long as as long as you have the requirements to travel, everyone can travel. Everyone is migrating there and here. That's it. So good luck, everyone, and have a nice night.
Thank you so
And we
much.
have, yeah.
Thank you so
Thank you
much,
so
Ms. Joyce.
much.
Thank you so much. Like I said, you were very practical. You were very hands-on when I came to learn, and so you left a mark. And I said, I mean, whenever we're going to be having this done in my country for my country people, and even for others. In fact, I want to mention here that we're organizing this training. Yes, we're starting with
Also,
Africa.
you see, I forget to mention, Philippines is the top tier
Yeah,
nursing,
yeah,
top tier. Can you
yeah.
imagine?
Absolutely, we see that.
We are factory of nurses,
Yeah,
because
absolutely.
the training in the Philippines is really,
Yes, yes,
it's very strict, it's very disciplined, it's very hard, it's very
yes.
difficult. Every hard and difficulty on exams and everything is there in the Philippines. Yeah,
Absolutely.
you cannot believe me. Like everyone is crying in my time.
Right. All right. So thank you very much. I wish that we can give you guys the opportunity to ask questions, but we can just take one or two because we have less than 5 minutes to round up. We don't want this to be for too long so people can catch a replay. I want to thank seriously Dr. Adigun for sparing this time out of your busy schedule. It was a short notice. Mrs. Oekeke Gado, thank you. It was a short notice. You wouldn't believe that most of the people I invited here, I told them in just 24 hours or 48 hours, and they were willing to come. That's to show you how people are passionate to transfer knowledge and to impact on the younger generation. If you have a question, Bukola Amao, please drop it in the box. I would respond to some. If you want to speak, I can just allow one person to speak because we have less than 5 minutes. Just one person to raise their hand to speak, and the others can drop the question in the box. I will read them, but we have less than 5 minutes. So if you have a question, please drop it. I will see it and I will read them. Other than that, if you have a question, you can raise your hand. Only one person. If not, you're in the WhatsApp group, you can drop your messages there. We're going to have to converge again by the end of the month, maybe the last Saturday before the start of the training. The training is proposed to start on the 30th of September. But if we do not have the numbers as we propose, maybe it can start in October. But we encourage you to confirm your spot now, pick up your application form. The application form is 10,000. We can send you soft copy, fill it, send it to the email. We have 11 students now. We're hoping before the end of the month to have 50. So if you're in this session, you just wanted to come and know the details, is an opportunity for you. You want to take it now because like I said, this tuition fee of 550,000 will not always be there. It might be more. Probably from next year, we might go back to our original fees of 1.5 million. The value you will get in this training is so much more. I would recommend that instead of going to spend your 4 years in the university, not sure you're going to get a job, come and learn a skill that immediately after you're done, you can get a job immediately because the industry is focused, the opportunity is there. So if you have a question, I can let one person, I haven't seen anybody's hand yet, but I think somebody dropped a question. After this training program, would the certification be recognized or respected outside Nigeria? Absolutely. I already showed you the accreditation body that we're working with for Canada and for America. You can do your Google search and search them. Recognized and respected outside Nigeria in regards to job employment. Absolutely. Please, ma, for the letter of recommendation in the form, is there no, don't worry about that. Just chat with me about letter of recommendation. If there is any other question, drop it in the chat. If not, I think I would have to beg that we might close because we don't have limited time and we want this replay to be enjoyed by the people who are not here. So we have to close officially before everyone leaves. Thank you so much, Dr. Adigun. I really appreciate you. We have never met, but your arms and your heart has been wide open towards me. I really appreciate it. Ms. Oekeke, we have so much we're going to do together. I really appreciate you. Ms. Joyce, you're a darling. You know, you're always positive spirit. Anytime we talk to you, you're always smiley, always happy. We want to provide the most value we can provide for all our students. So if you have any more questions, nursing assistant, including medical assistant, yeah, we will tell you the difference. If you have any questions, drop them in the WhatsApp group. But I beg you, we have to go now so we don't keep everyone, waiting. Just drop your message in the WhatsApp group and we'll take it from there. We will let you know when next we can converge. Maybe the last Saturday in September before the start of the training. Thank you all very much, everyone. Do have a good night.
Good night.
Thank you.
All right, good night.
Good night.
Good night, everyone. The classes will be physical. There will be online training for the person who asked. Good night, everyone.
Good night, ma'am.
Good night.
Good night. Good night, everyone.
Good night.